These are cases of subacute subdural hematomas. Left is the non-enhanced CT scan in elderly patient with a late subdural hematoma, subacute subdural hematoma, and the moderate cortical atrophy shows the difference between the nearly isodense subdural hematoma and the hyperdense CSF in the underlying compressed subarachnoid spaces. The right image is showing the subdural hematomas of different ages are common in elderly anticoagulated patients. The right subdural hematoma is subacute, that is, it is isodense with the underlying brain, and the left-sided collection is more chronic appearing. Note the severe compression of the underlying brain and sulci, and the fox is also partially calcified. Left is the axial non-enhanced CT scan in a 59-year-old man with seizures and no definite history of head trauma. And it shows a right frontal extraaxial fluid collection that is slightly hyperdense relative to the CSF in the underlying sulci. Right is the axial T1 weighted MRI in the same patient, and it shows that there are bilateral subdural collections that appear slightly hyperintense compared to the CSF. This is a typical MRI finding in subacute subdural hematomas. Left is the FLAIR scan in the same patient, and it shows that the subacute fluid collections do not suppress, illustrating their difference compared with normal CSF. Right is the T1 contrast enhanced scan in the same patient, and it shows that the outer membrane of the subacute subdural hematoma enhances. These findings are consistent with late subacute subdural hematomas. Chronic subdural hematomas. The left image is the axial graphic, which depicts the pathology of classic chronic subdural hematoma, with the formation of thin internal and thicker external membranes. Also noted are the stretched bridging veins, which are seen to be crossing the subdural hematoma, top to bottom gradation of the fluid from the serosanguinous to the more proteinaceous contents. Right is the axial non-enhanced CT scan, which is depicting the chronic subdural hematoma as crescentic hypodense extraaxial fluid collection over the left hemisphere. Stretched cortical veins are very faintly visible as they are seen to be crossing the subdural hematoma. Left is the axial graphic, which is depicting the mixed subdural hematoma. Numerous loculations that contain hemorrhages of multiple ages are present. Note the fluid levels with mixed acute and subacute blood. Re-hemorrhage into the pre-existing subacute or chronic subdural hematoma is quite common. Right is the axial non-enhanced CT scan, and it shows the classic left-sided mixed subdural hematoma. Also note the multiple loculations and the fluid levels which are formed by the acute re-hemorrhage into the pre-existing loculated chronic subdural hematoma. So again, some more images of chronic subdural hematoma. Left is the axial non-enhanced CT scan in an elderly patient with multiple falls, and it shows a bubbly fluid collection with loculations and multiple blood fluid levels. Right is the CT angiography image in the same patient, and it shows the bubbly crescentic fluid collection. Also seen is the inward displacement of the brain with compressed sulci and displaced cortical veins. Left is the coronal T1 weighted MRI in the same patient, and it shows the loculated pouches of fluid that are mostly hyperintense. A few hyperintense pockets of more acute hemorrhage are also present within these loculations. Right is the axial FAIR MRI image, and it is dramatic, showing that the hyperintense loculations, they contain numerous hypointensities, which are seen to be layering in the dependent portions of the pockets. This appearance is quite characteristic for acute or chronic, that is mixed subdural hematoma. Left is the T2 star GRI MRI sequence, and it shows multiple hyperintense blooming foci, which is consistent with hemorrhage into a chronic loculated subdural hematoma. Right is the T1 weighted contrast enhanced MRI, and it shows some enhancement around the margins of the chronic subdural hematoma, which is consistent with a membrane of the organizing granulation tissue.